Hello, and welcome to another chapter in the audio series, Voices of Hope and Recovery, Our Stories, Our Lives. I'm Marlise Franklin. Today, Dr. Daniel Fisher will be joining us to interview Congressman Patrick Kennedy. Dr. Fisher is a psychiatric survivor as well as psychiatrist, and he has devoted his entire career to advocating for recovery and encouraging and educating people about the grand possibility of recovery. He was recently on the President's New Freedom Commission for Mental Health. We're also joined by Congressman Patrick Kennedy, who has also devoted an amazing amount of time and energy to passing the parity bill. Congressman Kennedy, perhaps you could begin by giving us some background and perhaps an update on what's happening with the parity bill currently.
Well, our mental health parity bill simply says that when people buy a health insurance policy, that health insurance policy covers every part of their health, and that includes mental health. And right now, for some strange reason, they are charged a higher copay and deductible for health care when it comes to mental health care. And we are clearly seeing discrimination against mental illness, and that's why we're seeking to end this discrimination by passing the parity bill.
I really applaud this, Patrick, and for our constituents, mental health consumers, we're especially hopeful this will help in our recovery in terms of choice and community care. Do you see that as increasing options in terms of community care and choice?
Well, first, the most important aspect of this is that it'll break the stigma that has been long-standing towards mental illness. But what makes this bill so important is that there is a stigma against people who have these diseases. And if we do that, I think there'll be much greater investment, obviously, in the delivery of mental health services. And of course, there'll be much greater access to the services of mental health, and in doing so, there will be less reticence on the part of those who need these services to ask for those services, and so there'll be a whole cascading effect as a result of this legislation that will be a result that I think will be very positive.
This is modeled after the plan that government employees presently, congressmen and senators as yourself, presently are able to have.
That's correct. I base it on the very simple premise that if the health plan for members of Congress is good enough for the members of Congress, it ought to be good enough for the American public. And if members of Congress believe that they are happy with mental health and their health care package, then why shouldn't the American people have those same benefits accorded to them?
That's definitely parity. It seems like it also will overcome a big disparity in terms of the comparison of inpatient and outpatient. Right now it seems like there's often more money available for inpatient care than there is for outpatient care. Would this actually expand the availability of funds for outpatient?
Well, clearly this brings mental health into health care, and in doing so, we preempt mental health from reaching the more acute stages. Mental health problems reaching more of the acute stages. If mental health care is more accessible, then you don't find mental illnesses going to the lengths that we find it going to in many parts of the country where access is a problem. In some states where there are high rates of serious mental illness, it's really a result of the fact that those states are poor states with very limited access to mental health services. And what we end up doing is paying for it through the back door, through institutionalization, through jails, through higher healthcare costs in the healthcare system writ large, because an untreated person with mental illness has much higher healthcare costs in the rest of their healthcare bill.
It seems that this also will help with another big theme of our national coalition, which is self-determination and the involvement of people in their own treatment planning, which is, I think that this type of bill would really improve people's capacity to be involved in their own treatment planning. Is that sort of part of?
There's no question that we're moving towards a more community-based model, a more support-based model of care, healthcare-based model of healthcare, as opposed to sick care-based model of care in this country. And that has been the recommendation of the New Freedom Commission. Dovetailing with this change with the bill on parity, we need to do a number of other things as well in our mental health policies in this country to support that effort. But this would definitely go in that direction, yes.
Well, that actually is a theme of this national coalition that we've been putting together. It's a coalition now of 26 states, statewide consumer groups, and it is building on the White House Commission report of the New Freedom Report of involving consumers in policy, and it sounds like you're saying that's the direction you'd like to see.
Basically, this is a civil right. Frankly, it's a human right. It's a civil right. When you see, for example, that 75% of the women who are in prison are there for prostitution, and that is a result of their addiction, and that they can't get access to rehabilitation services that if they had access to would allow them to get off the street and live dignified lives that they'd like to live, but that they are held hostage by their addiction to the streets. This is an absolute issue of human rights, and I quite frankly find it reprehensible that as a nation that we do not provide those bed spaces for people to recover, and I find that and for those that have mental illnesses who may lose years and years of their lives wandering the streets because there's no one reaching out to them and no one giving them access to services, that those are years lost in their lives. That I think it's really unforgivable that this nation denies those people that life that they are entitled to. That is a constitutional guarantee. This country has guaranteed them, and they're denying them that guarantee by not providing them the support services to reclaim their lives. So I'm in absolute support of providing this health care, because it liberates people to become themselves and to be independent and to live full, actualized lives.
Really appreciate your passion in this, Patrick. Not only your policy, but your passion. It really comes through, and you speak, and I know you have spoken about your own work and your own life, and that's an inspiration, I think, to many people who have been struggling also.
Well, I have been very fortunate. I've had access to mental health care, but I've grown up with it in my own life, and I know the painful truth that this is a real illness. I've experienced it. I've also experienced the benefits of treatment, and I know what the benefits of treatment can bring. and the treatment isn't isn't always, you can't, you have to work hard at it, but I am very fortunate to have support systems, but I have access to medications, I have access to talk therapy, and I have access to support groups, and all of them are very crucial to my own recovery and to my own health and peace of mind and success as a human being. And I know that but for that support, I would be like someone with diabetes who didn't get their insulin shot. I would be going into diabetic shock. I would be unhealthy. I'd have to be hospitalized. And you know what? No one holds it against a diabetic when they are not following every regimen of their diabetic protocol. And we all know that far too many people in this country like to cheat on their protocol and eat their, cookies and, not always adhere to their diet and so forth and so forth. And there's a great deal of obesity in this country with respect to, with the rise in diabetes and so forth. But no one holds it against anybody, those people with diabetes, as a result of that, and that's behavioral. That's behavioral. No one holds it against it, but they sure as do hold it against an alcoholic if they have a relapse. They sure as do hold it against someone who's got depression, and if they fall back into a period of depression, they sure as do think that it's their fault. And I think that's the double standard that we see too often. People need to know that alcoholics have much better recovery than diabetics, have much better, than people from cardiovascular disease in terms of following their regimen and what their doctors tell them they have to do. But no one holds it against, someone with cardiovascular disease, or like I said, with diabetes, or an asthmatic. I mean, I'm an asthmatic, okay? If I go in and I play over at my cousin's house and they have animals, and I know full well they have animals, and I have an asthma attack and I end up in an emergency room, no one's condemning me and making a moral judgment on me that I was foolish to put myself in that harm's way, although I was probably just as foolish, if not more so, than if I put myself in a position where I walked by a bar, if I was an alcoholic. Oh, I just mean to say this in order to highlight for people what often isn't readily apparent, that there is such a double standard, and we don't always see it because it's so ingrained in our consciousness to hold it against alcoholics and to hold it against people with mental illness, that they have a higher burden of proof in terms of demonstrating their worthiness of treatment. You know what I'm saying? And trying to pass this bill, people are saying, oh, it's going to cost money. Well, of course it's going to cost money. But who said that treating diabetics doesn't cost money? Who said treating asthmatics doesn't cost money? If you want to save money, who says treating people with cardiovascular disease doesn't cost money? That costs a lot of money. But is anyone proposing that we take the money away from those treatments? Like, just let's not covering cardiovascular disease. No one would ever imagine doing that.
Is it the stigma that makes these separations?
It's the stigma. It's no question the stigma. Because, no one would for a minute say, let's not cover cancer to save money. They
Right.
would hang you up by your, toes on the hill if you ever proposed that. But if you said that today about mental health, there'd be barely a blip, because we're not even covering mental health as it is. that we have to put the face on mental illness, and it isn't the marginalized people, it's everybody. That's the misnomer. I mean, alcoholics and people with bipolar disorder, people with eating disorders, people with schizophrenia, we are everybody. We are everybody in this country. We are CEO of CNN, Ted Turner. We are members of Congress, Patrick Kennedy. We are
psychiatrist Daniel Fisher.
Psychiatrist Dan Fisher. We are everybody in this country. Jane Pauley. We are Terry Bradshaw. We are Mike Wallace, leading investigative reporter. We're all over society. So the fact of the matter is, if more people in this country put their own faces forward, it would make a huge difference in us passing this bill. Because, frankly, there's too much silence out there right now, and that silence is deafening. Politically, it's deafening.
What can we do to give people the courage to put their faces out there and to open up and to use their voices?
We need people to speak up and speak out. I mean, Dr. Martin Luther King, it was a spiritual movement where people did what they could individually. And what he inspired people was that if they did what they could individually, they'd be part of a collective movement that was part of something bigger than themselves. And we have to inspire that. This is not something that's going to be solved by one of us. It's going to be solved by all of us working together. And by working together we're going to make the change happen. Frankly, we need to come out in the numbers. We are the biggest disability group in the country. Mental illnesses affect more people than any other group in the country. I mean, that's just a fact. So we ought to be getting more money for our research than any other set of illnesses. But is that the case? No. We're far from it.
What is it about? Can you give me any numbers on that?
Yeah, we get less than $5 of every $100 goes to the National Institutes of Mental Health. And why we're not doing more when it affects the very quality of our lives. I mean, when you think that we're such a consumer-oriented culture that cares about happiness and self-fulfillment and purchasing the car and the house and being content and secure and, well off, you would think that we'd be more interested in what makes us happy and content and how our brains work and I just can't understand why as a country we're not more interested in our brains. How they work and how our emotions work and how feelings work and how to avoid a lot of the suffering that exists out there needlessly, because people suffer needlessly when we could be there to help people get freed from the imprisonment that they suffer from in their own minds as a result of these treatable mental illnesses.
You identified one of the reasons that I think people are afraid of other people who are having strong feelings or who are thinking or acting somewhat differently. And historically, we've just wanted them out of sight, out of mind. But when you point out that they are we, then that's very powerful. We can't put ourselves away.
No, I mean, everybody has to stop and think for a minute, and they don't have to think for very long about start in their immediate family, and then if they can't find someone in their immediate family, I don't think they have to go very far before they can find someone who they know's life has been turned upside down because of a mental illness.
By your speaking up in this fashion, I think that really does help make it safer for other people to speak up. And it's very, very brave of you there is a need, tremendous need, as you point out, for more people to speak up. And each time someone like yourself speaks up, that's going to make it safer for the next person.
Well, it's really no big deal on my book. I mean, I think it's a much bigger deal when people are living in this circus of a world where they're trying to keep it all hidden. And frankly, most of us who live with mental illness are living with juggling a circus around us to try to keep our lives together. It doesn't have to be that way.
With no, we have to walk the high wire with no net underneath, too.
Exactly. And
this would provide some net for people.
It does. And furthermore, we can take the paint off of our face. We don't have to masquerade ourselves, and it doesn't have to be, a big show anymore. We're putting on, a play for everyone else, and we can be ourselves, and we can have, real human-to-human interaction with the people around us. I mean, it's a whole new world to live in, and it's the world that life it's definitely worth living.
Well, it's also we can admit when we realize that people recover. I think part of the barrier to people admitting in the past has been that it's been painted as, mental illness especially, as a hopeless situation. But again, the more people like you, Patrick, speak up about your own recovery and being able to be part of society, then it won't be as hard to admit it because it'll be seen as, well, this is something people can recover.
Well, absolutely. Well, there are winners. There are winners out there. And I want to be with the winners. And I see them in my support groups. I meet them out there. And, my life is spent, trying to be with the people who are in the solution, living life in an honest way. And that's the big challenge in life. And, I think that there are people who are trying to do that every day. And the great thing about recovery is that it keeps you in touch with that. It's a very honest thing. That self-examination that comes from confronting your illness, I think in a very special way, you have a profound sensitivity to things around you and to other people that you wouldn't otherwise have had if you hadn't faced these illnesses. So I think in a way, there's a certain amount of gratitude that can come from it because you have a perspective on life that people who haven't faced these illnesses just won't ever be able to have.
It's a very humanizing experience. Brings out one's humanity. We're trying, it sounds like this would probably be of interest to you also, to re-educate the mental health practitioners so that they learn some of these new ideas too.
I'm just encouraging people to get out and speak. I mean, a lot of people who are in 12-step programs think that they have to be anonymous in their program. That's fine, they be anonymous in their program, but that doesn't mean they have to be politically anonymous, okay? Because they're still citizens of this country. And Bill W. Testified before Congress. People don't know that, but he did. Harold Hughes out in Iowa testified in front of his committee back in the 70s.
You're right, the substance abuse movement has not been able to have as much impact on policy.
Right.
Maybe through people who, speak to both issues can bring that along.
Right.
Your parody will also address substance abuse, as you've alluded to, right, as well as mental health.
No, that's right. I mean, it's frankly, it has to. They're co-occurring. Substance abuse. So many people, like myself, who have bipolar, self-medicated with drugs and alcohol, in an effort to, medicate and till I got professional help and was able to get on a proper regimen of treatment. But it's totally co-occurring, and we can't. Unfortunately, there's also this huge wall in between substance abuse and mental health, and in the dollars that flow from the federal government, they say, well, this part is substance abuse money and this part is mental health money.
That doesn't make sense.
Doesn't make any sense. No,
the person doesn't have that wall inside them.
Yeah, so we're working on that. But the point on the is that we do definitely need people to get more politically active, and we're often our this silence is really, I can't say it enough, is our own worst enemy, because people think that this anonymity thing, they have to just be quiet in everything, and that's not true. I think in politics, that doesn't mean they shouldn't write a letter. I mean, they don't have to identify that they're part of any 12-step group. They don't represent any 12-step group. They're just representing themselves as citizens. You see what I'm saying? They're totally separate. But you can't, as a citizen, allow this discrimination to go on, especially if you're someone who suffered from the disease and know that what's happening in this country is wrong, and then just not do anything about it. I don't think that the anonymity of the 12-step programs exempts you from being a citizen and just, expressing your viewpoints as a citizen, not as a member of a 12-step program. There's a clear difference between the two, and I encourage people to understand that difference.
There's actually been a challenge in the mental health community as well, because the stigma of mental illness has kept people from speaking and wanting to remain anonymous too. That's why we've put this national coalition together to get a larger voice in mental health issues as well.
It's very good for people to self-identify. After my car accident last year, and it was the big elephant in the middle of the room for every event that I went into when I was campaigning, and so I had to speak about it. And I'd go into these elderly high-rises, and I'd think, oh, geez, all these little old ladies will, they'd be terrified about hearing about drug addiction and alcoholism. They won't support me at all. They'll be totally repelled by the notion. Well, I get into talking about my situation and how I'm working on parity and how this is a big problem in America and it's going unaddressed. And after my talk, I'm going around and saying hi to everybody, and they're all telling me about their own depression. And they're all whispering in my ear, that their spouse died, last year, and that their son took them, they couldn't eat, couldn't get out of bed, and their son took them to McLean Hospital, which is a mental hospital up in Boston, and they got put on some antidepressants. They feel so much better, but they say, I can't tell anybody, and they said, outside of my son, you're the only person I've ever told, And it's so funny because, I'm going around, I'm having I had members of the media telling me about their stories. I was going around the state. I got my biggest vote totals ever in all of my elections. And I had the press talk shows were going after me on a regular basis, attacking me and calling on me to resign and all this stuff. And my numbers were the biggest numbers, 69%, biggest numbers I've ever had in my whole election career.
What impact do you think that parity will have on the social networks or on social programs that assist people who have been diagnosed with a mental illness or who have been hospitalized, who are attempting to reintegrate into society?
of course, it'll be a big blow against the stigma, and in doing so, it'll make it a lot easier for us to tear down those last vestiges of discrimination. Frankly, we're already doing it in many states. In my state, we've already eliminated the housing discrimination against those who've had a conviction of previous conviction, drug and alcohol conviction, from getting government-subsidized housing or public assistance. Now, what really doesn't make any sense, the real rub that people are coming out, we have 600,000 people a year coming out of our prisons, federal, state, local, and they're in our communities. They're living amongst us. They're our neighbors. And they need to, there's 70% recidivism rate in California alone in 2-year period. And in most states, it's well over 50 in that period of time. Unless we do more to have open up opportunities, all we're going to be doing is consigning people to dead ends. And of course, our correction system has really been the mental health system of last resort. We have had hearings around the country. I met with Sheriff Baca, who's head of the Los Angeles County Jails, and he told me, I run the largest mental health institution in the nation. I run the Los Angeles County Jail system. And 2/3 of the people in his jail system are, diagnosed with mental illness. I mean, and we don't have the facilities to make sure that they're treated for their illnesses. Of course, there's no drug treatment in prison in many of these cases. Of course, there's no transition and halfway houses out after prison. And of course, underlying a lot of this is, we're not doing anything for the families. These kids of prisoners are 6 times more likely into prison themselves. I mean, this stuff is not rocket science. They've all been subjected to terrible trauma. A lot of these prisoners 70% of the kids in our juvenile justice system have all had parents in the adult correction system in Rhode Island. 70%. I mean, we are just are so backwards in this thing that, but we can't afford to keep going in the direction we're going in.
Is there anything you would like to add that we haven't covered for wrap-up?
Dr. King talked about civil rights. This is the civil rights fight of our day, and it is absolutely vital for people's dignity and their sense of self-worth, and for us to carry this fight on, and we have to fight hard for the can't fight for themselves. Mm-hmm. I encourage everybody to do everything they can to, go that extra mile, to pick up the phone or write a letter to the editor, or, call into a phone, to a radio show, or do whatever they can to raise the temperature on this issue.
We'd like to thank Congressman Patrick Kennedy. Thank you so much for sharing your time with us and for educating us about parity, and also for all the hard work that you put into reducing the stigma and the discrimination against people who are diagnosed as being mentally ill. Thank you very much. And also to Dr. Daniel Fisher, who was also the other voice in this interview. And Dr. Daniel Fisher also has a story on the audio series Voices of Hope and Recovery. If you would like to order another copy of this CD with Congressman Patrick Kennedy, or any of the other stories in the series, for example, Dr. Daniel Fisher, feel free to contact the National Coalition of Mental Health Consumer Survivor Organizations. That number is 1-877-246 9058, or visit the website at www.ncmhcso.org. You may also email the National Coalition there at info@ncmhcso.org. I'm Marlise Franklin, and thank you very much for listening today.